The left atrial appendage occlusion device. This is a filter that we can place in the heart, just like a heart catheterization, without open heart surgery. We know the majority of clots during atrial fibrillation come from a very specific pouch in the upper chamber of the heart called the left atrial appendage. So now there's an alternative to taking anticoagulation or blood thinners long term, and that's what this device will do. It's a filter that we can place in the heart, and then it protects you from clots that can cause major strokes. And at some point, a few months after the procedure is done, you can come off your blood thinner. The left atrial appendage occlusion device is placed with catheters, like a heart catheterization, going in from the groin under general anesthesia. We go up to that part of the heart where the pouch is, and we put this filter into that device. The procedure itself takes about an hour to do. You stay overnight and go home the next day. 45 days later, we take a look to see if your body is completely sealed it, and when that occurs, then we can take you off your blood thinner. There are many patients who cannot take a blood thinner because, for example, they have a major bleed. They bleed in the head, or they have a major ulcer, or they keep falling and injuring themselves. So it's dangerous for them to be on blood thinners long term. This device can take the place of a blood thinner, and the studies have shown it over many, many years that this is just as effective as taking a blood thinner, particularly for left atrial appendage occlusion device. Myself and Dr. Steiner have been trained with this. We've been doing this since we brought this onto the field to Orlando since 2016. We've done hundreds of these, and we can bring that to bear. We also have the ability here to use one of two devices currently available in the market, so we have the ability to choose which one is best for the patient's atrial appendage. So we have the technique to be able to look at your atrial appendage ahead of time, figure out which of these two would be best for you, and use the best one for you at the time of implant.